More than half of those are suicides. Um, the root cause of suicide is economic disparity. It's culture. It's mental health. It's all of these other things. Um, Suicide with a gun is far more deadly than suicide with other methods. It's 2 or 3 or 4 or 5 times more lethal than other methods of suicide. And that matters because when people survive a suicide attempt, I think it's over 90% of the time they go on to live long, fulfilling lives. They don't end up dying from suicide down the line. That second chance is really powerful and it's really important. If you can remove guns from the equation, from the suicide equation, you can save a lot of lives. It's not the solution. It is a band-aid. It is symptom treating. It is not disease curing. It's not meant to. But suicide is a symptom that you cannot recover from. There are some very simple, quick, and easy things that we can do right now to dramatically reduce the number of gun deaths. Things like universal background checks, things like universal waiting periods. These are simple things that we can do right away. Closing private gun store loopholes and stuff that can just save a lot of lives. It's not gonna get us from 40,000 to zero. It's not meant to. It's meant to get us from 40,000 down to 30,000, 20, 10, or 5. That's what it's meant to do. Because solving the root causes, solving the diseases, it's going to take a lot of money, energy, resources, people, and most importantly, time. It's not going to happen overnight. We're not going to, like, solving the disease is going to take a lot of time. And so, how do we solve the disease? Well, universal basic income, universal quality healthcare, right? These are huge. Shifting the way that we culturally, this like separation of physical health and mental health is poisonous. They are arguably one and the same. Things like how many. The number used to be 22 vets a day. I think it's down to 19, which is great, but it needs to be 0. In the military, if you check a box, and this is the same for nurses in emergency rooms, this is the same for like police and a lot of departments. If you check a box that says, "Hey, I experienced something traumatic, I need some help," you can lose hours, you can get pay cuts, you can lose your position, you can get punished in all these other ways. And so instead, they don't check the box and they just have to deal with this trauma in their own way. And typically the way that that's dealt with is compartmentalization. And like that's what police do, man. They can't live their lives after seeing some of the stuff that they see unless they compartmentalize it off. You can't blame them. It's human nature. It's a defense mechanism. And so if we, I would want to just write a law saying that like if you say that you need help, like mental help for dealing with traumatic things in any profession, from like private industry, public sector, whatever, you cannot have like unless you want to get any pay cut of any kind, no demotion of any kind. You stay the same. That's really powerful. Reverse boot camp for military. You're coming out of the military. You go through boot camp when you get into the military to get on the very regimented schedules. Come out of boot camp, you can have a reverse boot camp to help get reacclimated to normal life. These are some of the more comprehensive things to start dealing with these problems.